I'm definitely a little bit nervous because this is a big surgical procedure and it has to do with my eyes. I wear my contact lenses from like the moment I wake up to the moment I go to bed, and my eyes are constantly dry. So I'm excited to just wake up, open my eyes, and be able to see. Hi everyone, my name is Sara Tan. I am the beauty director at Refinery 29, and today I am going to get the EVO ICL procedure to correct my vision. I am currently nearsighted. I've been wearing contact lenses since I was in middle school, and I'm really looking for an option where I don't have to wear my glasses anymore or my contact lenses. At first, I was really interested in doing LASIK, and then I learned that I didn't qualify because the size of my cornea was a little bit too thin. And then I learned about EVO ICL. It seems a little bit less invasive because it's not altering the shape of your eye. And basically you can see the next day. It's almost like 20/20 vision. From what I hear, it's a pretty simple and quick and very safe procedure. And what I love about EVO ICL is that it's actually reversible. So if anything were to happen, they can remove the contact lens.
I'm Dr. Rainey Wu. I'm a cataract and refractive eye surgeon at Laser Eye Center here in Los Angeles, California. Surgical vision correction can be done in two ways. One is a laser-based method and another is a lens-based method. Laser-based refractive procedures like LASIK or SMILE are performed on the surface or cornea of the eye. The laser essentially reshapes the cornea in order to correct your vision. With lens-based approaches like EVO ICL, we actually implant a lens inside of the eye to correct your vision. A patient may choose EVO ICL for a variety of reasons. They might want a surgery that is reversible, that can be removed at any time if they wish. They might be worried about things like dry eye or already suffer from dry eye and don't want to worsen that with a laser-based procedure, or they want a procedure that will preserve the cornea. Most surgical vision correction procedures aren't typically covered by insurance, but if you compare the long-term cost benefit for a one-time procedure versus a lifetime of buying glasses and contacts, you're definitely going to come out on the better end by investing in yourself in this refractive procedure. Surgery day for EVO ICL starts with getting dilated. So you go through several rounds of eye drops so that your pupils get large enough for us to perform the surgery. We clean the surface of the eye and the eyelashes with a betadine solution just to make sure all the germs, any bacteria are effectively removed from the field. This procedure is done in a sterile field. We want to avoid any risk of things like eye infection when performing the procedure. We then drape the patient and we insert a speculum. It's basically an eye opener to keep the patient's eye open during the whole procedure. Then we get started by preparing the EVO ICL. We remove it from its vial, and this 12mm lens is very small, but we have to fold it up like a taco in order to insert it into the eye. So the first step is just preparing the EVO ICL in a small cartridge for injection into the eye at a later point. We insert some numbing medication into the eye and then a solution just to keep the eye shape. The next step is creating very small microscopic incisions into the eye, some openings where we can insert the EVO ICL. We slowly inject the EVO ICL and watch it unfold, making sure that the positioning is in its correct orientation. And the next step is tucking each of the haptics, which are the 4 legs on the EVO ICL, underneath the iris. And from there, it's really just meticulous rearranging constantly, adjusting that ICL to a very specific location on the eye. That's really critical to make sure we can treat all of our astigmatism. And then rinsing repeatedly several times to make sure everything comes out while maintaining that position of the ICL. The incisions that we make are very small, about 3mm, and we're able to just use fluid, a water-based fluid, to hydrate those wounds, and that completely seals them shut. So we don't need any stitches for this procedure. What's great about EVO ICL is you can have both eyes done on the same day, one eye right after the other, so you don't have to come back for the second eye. Immediately after the surgery, we place some eye shields over the eye for protection. And what's really interesting is that you can start seeing almost immediately. Things are going to be still a little blurry, but you'll immediately begin to appreciate details that you wouldn't have been able to appreciate without your contact lenses.
You did it! Oh my gosh, yay! That was so
I always recommend the first day after surgery just to rest as much as possible, sleep as much as you can. By the next day at your post-op day 1 visit, you'll be able to see. And most of my patients are 20/20 even on the first day after surgery. But we do notice the vision continues to improve. The quality of the vision will continue to improve each day after that.
Okay, it looks really good.
Yay!
How have you been feeling?
Good. It's amazing.
There's not a day that passes that I don't think to myself, oh my God, why didn't I do this sooner? The entire procedure itself probably lasted like less than 30 minutes. Dr. Wu was incredible, super quick, kept in touch with me, made sure I was comfortable, made sure I knew everything. Literally, like right after the procedure, I could see, like the next day I could see, and it has only gotten better. It's just been life-changing. I know that people say that, but it's just been the best decision I have ever made, and I wish that I would have done it sooner.